designed research projects to look at this problem.
Dr. Wagner, are the studies that are prompting your research, are they suggesting that people who have a vitamin D deficiency are more susceptible to contracting this virus, or once they contract it, that the symptoms are more severe or they're more likely to die? Or do you know yet?
Yeah, I don't think we can say about whether or not they contract it more frequently, but certainly the severity of illness around the world is linked with vitamin D deficiency, so there are more and more reports coming out about that. And it's really clear that when you don't have a vaccine for this disease and you don't have any effective treatments, that something as ancient as vitamin D is going to have an impact. And so it really makes sense from our perspective. And we're looking at that. We're really trying very hard to understand the role of vitamin D in combating COVID-19.
So let me stay with you. And I know we're talking about a study that's beginning, not the results of the study, but is the expectation that a simple vitamin D supplement will potentially close this gap and I guess narrow this disparity?
Yes. So if we can get individuals who are vitamin D deficient sufficient before they contract the disease, we think that's going to have the greatest effect. And clearly, during early childhood, during fetal development in early childhood, we set the stage for your immune system, but it can also be impacted through the lifespan. And there really is evidence to suggest that the severity of COVID-19 will be really lessened if you're sufficient going into this next wave of the infection.
Dr. Hollis, we've heard from other public health experts that there are societal explanations for why African Americans have a higher instance of contracting the virus, or the death percentage of African Americans is higher than relative to the population. Is this a clearer explanation? Does this exclude those other variables? How do you see those two playing in concert, if at all?
Well, certainly the lack of health care, but we believe that this is probably the main underlying problem, which goes to the other underlying health problems such as hypertension and diabetes. All these things we feel are linked to low vitamin D levels over a lifetime. And African Americans as a population have 1/2 or less of the circulating blood levels of vitamin D as fair-skinned individuals. We've known this for decades.
All right, and before we let you go, CDC is reporting a massive drop-off, Dr. Hollis, in orders of childhood vaccinations. Since the start of this pandemic, Washington State Health Department, look at this chart here, reporting giving out 42% fewer vaccinations in April versus April of 2019. Any idea why, and what's the significance, since we have a pediatrician with us?
I think it's just access to the office. You can't get a vaccination over telemedicine, and people are limited by the time they can get into the doctor's office, including myself. And people are just afraid to go to a doctor's office or a hospital. So I think it's pretty much that would be the reason.
Yeah, they're certainly going to need those once this social distancing ends. Dr. Hollis, Dr. Wagner,